So medication-assisted treatment for opioid addiction is this. You really have one of three routes that you can take to treat opioid addiction. And this is all about protecting the opioid receptor in your brain, because this is a brain issue. This isn't a whole body problem. So the old tried and true classic methodology has always been methadone. So understand that methadone is considered a full opioid agonist, meaning it hits the opioid receptor in your brain and fires it, much in the same way that Norco, Vicodin, Percocet, heroin does, actually. So, but the reason why it works well for the right person is that it's a long-acting, slow-onset medication. Yet, there are some dangers to it. You can still overdose. You can still use on top of it, putting you at risk. At the far opposite end of the spectrum is something called naltrexone. Naltrexone is an opioid antagonist, meaning that hits the opioid receptor in your brain and blocks it out completely. So, again, for the right person, that is the right medication. It will prevent you from overdosing because you can't use on top of it. It will not mitigate your withdrawal symptoms, however. So again, it has to be chosen in the right capacity. In the middle, there's something called buprenorphine. Buprenorphine is what we call a partial opioid agonist, and that hits the opioid receptor in your brain, fires it partially, and then snuffs it out, is the best way to describe it. So pharmacologically, it's the ideal medication to use given a certain situation. So you have to individualize and tailor treatment according to the type of patient you have. So it's not a one-size-fits-all. So the reason why I like this medication is it's very safe. For someone who is opioid naive, there's some potential downfalls. But again, someone who has an opioid-dependent issue, an opioid use disorder, it would only help them. It will not get you high. You cannot overdose on it. Even if you use more than you're supposed to, more than you were prescribed, it would have the same effect due to the ceiling effect of the medication. And by that, I mean, if you only needed 12 milligrams, for example, for you to feel completely normal and have no withdrawal, taking 36 milligrams that day will have the same effect as 12. So there's no point in doing it. And once you're well into recovery, you come to realize that. And so in that regard, you maintain a certain medication regimen.